What do I wish this good-looking, handsome, mildly intelligent bugger and his gorgeous new bride knew in 1998 that he's learned 25, 26 years later? I'm Mark Copeland. I'm the Value Analysis Whisperer. This is Sutures and Cents, where we talk business to clinical, clinical to business, clinical to clinical, and business to business. And we're going to talk about that today. Ryan Pistone is my right-hand man, consigliere, and genius and expert, and you should follow him on LinkedIn. He's very smart, talks about small med device marketing. You'll learn something from him if you follow him. And he's a little chip on his shoulder, and I like that too. But what did I wish I knew then about selling that I know now that really helps with why people follow and listen to me? New product approvals, either in ambulatory surgery centers, hospitals, or health systems, that value analysis, right? Well, here's how I have learned and grown and matured through failure many times, because that's how all we all have to learn, but through reading, learning, paying attention to other smart people, and just getting better and better, trying to get better every day, right? We all know what that's like. So here's what young dummy Copeland, big dumb Cope, in 1997, 98, here was my sales approach. I'm going to talk about my product and tell people how cool it is. Sound familiar, right? We're all guilty of it at some point. Some of us just try to get better and get out of it. But that's what I would do. And I'm going to give you an example. We're going to use one here on this podcast that to explain how we tie all this together. And I'm going to tell you what the fifth level of success I've learned that you can do too. And that's why I've designed all this stuff is for you to be able to go from 1 to 5, but at least go 1 to 2, 2 to 3, one level, right? Get a little bit better. Don't worry about 5 if you're not doing 2. So I would talk about my product. Hey, doctor, my antihistamine works faster, stronger, longer than Claritin. Whee, right? And you start to learn how to do it better and all that good stuff. And then as I got older, I read some things. I went to some good sales training courses. Some I paid for, some were delivered by my company. Um, I learned to talk about their problems, not just my competitors' problems, but my clients' problems. Hey, if you're seeing this, is that something you run into? Because we may have something that helps. And it sounds like this. And I would listen to lectures from spine surgeons or listen to discussions of read journal articles, and they'd say, "Oh, here's the problem. The problem manifests this way." And I'd say, "Oh, that's interesting. Here's what the problem manifests, right?" And I'll be talking to my individual end user, sometimes a doctor, sometimes a nurse. And I did that for 5 or 6 years and got pretty good at that. But then I learned, and I don't remember what drove me to this, but this was a big improvement in my sales game, was now taking problems others had that were just like my potential customers and describing their problems to my customers. So instead of me coming in and saying, well, I'm sure you probably see this issue, because a lot of people will say, no, no, I don't, even though they have it. They don't want to admit it because they don't know, like, or trust me yet, or they don't think they have it, or they don't want to admit they have it, or they don't want to worry about it. It's not that big a deal, right? But when I started to say, well, you know what? I have been to 3 different hospitals today, and each one of them says they have blank this problem. Like, are you guys running into that? It seemed to open the door. It seemed to get people to say, oh, you're not saying I have a problem. You're saying others that are a lot like me have a problem that we do too. And it would, you would say to them, yeah, they're struggling with it. They said it's okay to say it. They can't find enough people for this, or they don't have enough machinery or equipment for this, or they have a bunch of newly hired doctors coming in who have an expectation of robotics or navigation or um, image guided blank, and they don't have it. And they would say, "Oh my gosh, yeah, we're having the same problem. We're running into it." Right. And you could say, well, here's what I think they're thinking about, but what are you guys doing to tackle this? Do you have a plan? Is it even that big of a deal? And they would talk. And I think it helped that they realized, oh, Mark's not big dumb Mark, big, but less dumb Mark at 3 was in a bunch of places having these conversations. He must know he must see some things. Maybe he can tell us about what he sees out there. And it's becoming much more consultative, right? But ultimately, here's what I learned 10 or 12 years ago that has really transformed and springboarded me into better sales is when they start talking about their problem, what I want to be able to do is say, I'm the one who knows how bad the problem is here better than anybody. So I don't want to just say, hey, your ICU has issues just like all the other ICUs. I want to say your ICU has issues just like the other ones, but here's how it looks in your place. And to do that, when you're talking to them, you're asking these folks these questions. You're saying, wow, you guys have that? I mean, does it affect who else? That has to affect peri-op, or it has to affect the ER. It's got to, does it? And they're like, oh, yeah, yeah, man. We were just in a meeting. They were killing. And you go down and say, is it okay if I go talk to those people and find out what they're dealing with? And they'll say, oh, yeah, send them down because it'd be cool if we could figure this out. So I end up talking to all the people in that. It's sort of like an ecosystem, right? It's an ecosystem because all of these places in healthcare, hospitals, ambulatory surgery center, they're all tied together with a thin string. Sterile processing, anesthesia, surgeons, vendors, doesn't matter. They're all tied together by a string. And when one gets pulled, the others do too. And you want to find out what's that pull or push feel like? What's that downstream issue? So to the at the end of it, I spend a lot of time in these places not saying my product works. If anything, I say, listen, I have a product. It might help with this. I actually suspect it might, but I want to make sure you guys have a problem. The OR tells me this. ER is telling me, and it's manifesting there like this. Are you guys running into this? Is this affecting you guys? Now, sometimes they say no, right? But sometimes they say yes. And then you just, well, what's that look like? Does it slow you down? Does it take your nurses away from patients? Is it a documentation thing you're falling behind on? What? And they tell you and they talk to you. And now you start to realize the true like problem. And what happens is you start to go back and talk to each department. You go to the OR and say, man, I talked to the ICU and you're never going to believe here's what they told me. And someone like, oh, yeah, we knew a little bit. I didn't know it was that bad. And then SPD said that. And they're like, whoa, and you're telling SPD what the OR is saying, and OR what ICU is saying, and ICU what SPD is saying. You start to learn all this stuff. You will now know their problem better than they do. And you've heard me say this, I want to be the king of pain. I want to be the expert of the domain. I want to be the expert of their ecosystem domain. And every place is a little bit different. But when I can verbalize the pain, right? And that's knowing their problem better than they do. Because a lot of times the ICU knows it causes a problem, or the OR knows it causes a problem downstream or upstream, but they don't really truly know it. But when I can describe it, they're like, they pay attention. Now, hopefully that makes some sense because this is literally me going from I'm just talking to a doctor to I'm talking to departments and entire systems. And that's what we're doing in med device these days. We're not just calling on doctors or maybe a nurse end user. We have to talk to systems, right? And to do it, we have to be able to get to this point if we can. But you can't jump from one to four. You got to learn how to do two and three, in my opinion. But number five is the key. And I'm going to write it in. Here's what it is. Sorry, my penmanship's bad. But number five is economics. Can I not only describe qualitatively the smart people? What's it feel like emotionally? We're always behind. We have to hire more people, and that's a pain. And half of them are going to quit, and it's annoying. And I get home late, and my wife's upset, or my husband's upset, or I missed the kids' game, and this is frustrating. I'm worried about patience. Like you can't put a number on that, but you can say, well, if it delays you, and it adds to your length of stay. Does that cost something? People will say, yeah, it's about 1,500 bucks. You start to add in the economics, and it's their economics coming from their people. It has incredible credibility. And as I put it all together, this is where, when you hear me doing a home run executive business summary, I'm summarizing 4 and 5 because I've now learned all of their problem and how much it's costing them. And this is how this whole thing works. So I'm hoping this helps people, but I would urge you, if you're number one, this is sales training. If you're just talking about your product, you got to you got to get to number two. You got to talk about their problems. And I'm actually going to do a video about that too. I learned from a great book years ago and a great course and how I do it because it really helped me. Maybe it'll help you. But as you start to do these things, and especially the more experience you have, or the more talent you have, or the better training you've had, you may be already here. You may be here. But if you get to here, you become really, really, really effective in we didn't have to do this. It helped. We didn't have to do this 15 years ago. We do now. You can do it. I'm going to try to help. But this is what I wish this big dummy and his beautiful new wife knew back when he was just doing this. I'm Mark Copeland. I'm the Value Analysis Whisperer. I help companies and new reps and old reps get their new products approved in health systems, ambulatory surgery centers, and hospitals. We'll see you next week.